Whether you have had children before or you are trying to get pregnant for the first time, this is a step-by-step guide on how to plan to make a baby. I am so excited about this topic because I know that it is going to help so many of you who have been struggling to get pregnant. If you're watching this video all alone by yourself, please bring your partner closer because both of you would need to do these things together to make it work. Getting pregnant is not a one person's job. It requires two people to make a baby. So call your partner, sit together and watch me as I teach you the step-and-step practical guide on how to make a baby. Some of you will say things like making a baby is an easy process, possibly because you've had a child before or you are going to try for the first time and you are excited about it. The truth is that a lot of people are struggling, and majority of you who are watching me right now are probably struggling to have your positive results. So it is important for you to know that while it can be easy for some people, it might not be easy for others. So you have to take active steps towards getting that positive results that you so hope for. If you're seeing me for the first time, I am the Wongo Nation president. I am a fertility coach and also a sonographer, and I have been teaching a lot of couples how they can maximize their fertility, and the truth is we are getting a lot of results on a daily, weekly and monthly basis. If you want to get more insights concerning your fertility and how to get pregnant, and also about your sexual health, ultrasound in pregnancy in general, this is the place for you. All you need to do is to put your notification on, just touch that subscription button, and then let's kickstart the class. Step number 1, understand the concept of fertile window. I will not stop talking about the fertile window because so many people don't know about this particular concept. They just think that pregnancy happens by chance. That is, if you meet your partner, then pregnancy will just happen. The truth is you have to meet your partner during your fertile window for pregnancy to happen. The concept of fertile window is very, very simple. And that is the sperm lasts about 3 to 5 days inside of the female reproductive system, and the egg lasts just for 24 hours. So you want to have sexual intercourse within this fertile window. That is starting from 5 days before the woman's ovulation happens and then continue till a day after her ovulation to help you streamline when you are actively trying for a baby. For a couple who are staying together in the same house, you might not want to think so much about the fertile window. You might just want to be meeting each other every other day, every other 2 days, and this can help you to get that double line. Even at that, you still need information about the fertile window because a time could come when trying to conceive looks like a chore, or you might not actually be in the zone when you want to have sexual intercourse with your partner, but you actively want that baby. And both of you, because you know the concept of fertile window, you can meet each other at the right time and have your positive results. There are certain ways you can know when you're fertile. Number 1 is with your signs and symptoms, which can range from things like cervical mucus production. My ladies, you should know what your cervical mucus is, the fertile and the non-fertile one. If you don't know about cervical mucus, I am going to be putting out a video out there explaining everything about your cervical mucus. So make sure that once that video drops for you guys, you are going to see it. You can also use calculation to know when you are fertile, and that is 5 days from before your ovulation day until a day after your ovulation. Apps have made this particular method simple because you can simply just download an app and then it can do the calculation for you. Calculation is not suitable for everybody because we are not all clockwork. So some people will have a cycle that is not constant or that is irregular, and calculation method might not work perfectly for you. So in that particular case, you still need to know about your signs and symptoms. I mentioned cervical mucus earlier. Other things like one-sided lower abdominal pain, having sexual urge for your partner, great sense of smell, breast tenderness, and also acne on your face, high level of energy. All those things are pointing towards your fertile window. Finally, if possible, make a couple goal for healthy living. When one person's goal is to be healthy and the other person's goal is just to live life the way it comes, it might not be easy for you, especially if both of you are planning for a baby. And a healthy lifestyle is very essential because it helps with your gametes, that is the egg for the woman and the sperm for the man. Health healthy lifestyle should not be negotiated if you are planning for a baby. So make efforts towards living healthier if you are a couple who is planning for your next baby. Number 3, go for your pre-conception checkup. Some of you have heard that you don't go to the hospital until a year after you started trying. That is not actually how it works. That 1-year rule doesn't apply to everybody, and in fact, it is important that you have a very good knowledge about making a baby before you start. So if you're trying to conceive couple, maybe you people just met each other and you are making plans towards having a baby, it is good for you people to go and have a pre-conception check. Pre-conception check is not only to check whether you are healthy enough to make a baby, it can also help to identify if you have any health challenges that can cause issues during the pregnancy, or whether there is a health condition that is affecting both of you that can be transmitted down generation. So it is not just, oh, go for pelvic scan, go for HIG, go for semen analysis. There is much more to that. So during your preconception checks, there could be blood checks to know whether you are deficient of certain nutrients, and there can also be certain blood checks that will help to know whether both of you are compatible, especially when it has to do with things like resource. Do you know about resource compatibility? You probably have heard about it, but you might not know much about it. That's why I'm here as your fertility coach, because I am going to be explaining resource compatibility in another video where I would explain it properly to you. And every couple who are hoping to make a baby in the future should know about this, because it holds a lot of water when it has to do with you continuing your conception journey and having healthy babies. If you've watched this video till this point, it means you love what I do here, and I love you as well. You can ask your questions in the comment section and I'll be more than glad to take them. If you're seeing me for the first time, I am an obstetrics and gynecology sonographer. I am a radiographer and also a fertility coach. People know me with Wongo Nation President or Celebrity Sonographer. So some of the preconception health checks you want to go for are things like STI checks, that is sexually transmitted infection for both the lady and the guy. Majority of people will have STIs without knowing that. So having that knowledge and also treating them properly is going to preserve your future fertility. For the lady, she might also want to go for her pap smear test. This pap smear test is really important because it helps to identify if you have cells that can become cancerous in future. So very important to you. For the man, it is going to be a very good idea if you could check your sperm. Very, very important. I don't know why you men usually don't want to go to the hospital to do like semen analysis or check your sperm. I don't really know why. I can't explain it, but it is really important that you do this pre-conception checkup because it helps you to know where you are, and if your sperm needs a little bit of help, the earlier any issue is detected, the better for both of you. Number 4, start taking your prenatal vitamins. Prenatals is not just for the lady, so the man should also be on his own vitamins as well. Prenatal vitamins is one that should contain folic acid for the lady, because folic acid has been shown through research to reduce the incidence of neural tube defects, which are issues that can be affecting the baby's brain and spine as well. For the man, he can benefit from having supplements that contain zinc, because zinc has been shown through research to help with his sperm quality. Before you go on supplements, ensure that you speak to your doctor first. It is really necessary. I am not your primary healthcare provider. What I am giving here is general knowledge and should not be used as a medical advice. Keep track of your journey together. This is really good for memory making. So you guys can have a little, planning box for your little one. It is a very, very lovely thing that is coming into your family. So you both can have a little box where you can share memories of your journey. You can also put this in video form. You don't have to share it with the whole world. This is something that both of you can look back on and be like, well, we've come through all this. And if you're going through assisted reproductive technique as well, it might be one of those things that you can do, having a memory box for your journey. This is not this is not a must for trying to conceive, but it is one thing that you can do that is very exciting, and looking back at it maybe in the next 5 to 10 years, you'll be glad you did. If you've watched my video to this point, it means that you love what I do here, and I love you too. I want you to put your notification on and also click on that subscribe button, because I am not going to hold back from giving you all the information that is going to help you in your trying to conceive journey. What is that one thing that you're struggling with in your trying to conceive journey? I want you to tell me in the comment section. I probably would make a video for you. I'll see you guys again in my next video, and I'm still your Wongo Nation president. Bye.